People behind a local push say they have reached a settlement that will get youth sports safely up and running again. Some of the changes the state is making to the vaccine rollout to target the hardest hit communities and how that could impact the reopening process. And some proceedings in the nation's capital put on pause the intelligence that had leaders concerned the capital was facing another threat. ABC 10 News at 11 starts now.
ABC 10 News at 11 starts now.
Hi, everybody. Happy Thursday and welcome to ABC 10 News at 11. I'm Virginia Cha. My co-anchor Jim Patton and meteorologist Megan Perry are both here as well, virtually, and we're going to hear from them in just a moment. But first, we want to start with this. Health officials say they are making changes to the state's COVID-19 tier system, which could soon move San Diego County into a less restrictive tier. ABC 10 News reporter Marie Cornell shows us how vaccine distribution will play a huge role in this change.
State health officials say they're making changes to the COVID-19 blueprint because of the latest data, and now there are 3 vaccines that will be available for use. As soon as the state vaccinates 2 million people who live in the areas the state considers as the most disadvantaged zip codes, metrics of moving from the purple to the red tier will change. Right now, the case rate metric needed to move into the less restrictive tier is 7 new cases per 100,000 residents. It will now be 10 new cases per 100,000 residents, which is where San Diego County currently is, which means the county may soon move to the red tier. Dr. Mark Ghaly, the secretary for the state's Health and Human Services Agency, says they are doubling the allotment of vaccines for the hardest hit communities. But it doesn't end there. They are also making sure those vaccines get to the right people.
To make sure that the vaccines that arrive in the communities are reserved for those who live in those communities, because sending it there is one thing, but ensuring it gets in the arms of those who are most vulnerable in these communities is a whole nother.
Ghaly says once the state reaches 4 million people within those designated communities, there will be changes made to the requirements needed to move from the orange to the yellow tier. He adds the new designation of vaccines will not impact the next group in line to get the vaccines, which are those 16 to 64 with high-risk conditions and disabilities. He believes the state will hit the marker for 2 million vaccines within the next 2 weeks. Marie Cornell, ABC 10 News.
Well, meanwhile, some more supply issues here in San Diego, this time forcing the Del Mar super site to be put operations on hold. Scripps Health saying it got a smaller delivery than expected this week and will need to shut down that site at the fairgrounds on Saturday. However, they expect to be back up and running Sunday, and they say patients who had appointments Saturday, all of which were for second Pfizer doses, were automatically given Sunday appointments. Virginia?
And thank you so much, Jim. Among the changes that could be on the horizon, fans could be back in the stands at baseball games. The governor's office is in talks with Major League Baseball about potentially allowing fans at games next month. It would depend in part on case rates continuing to trend downward. The Padres opened their season at Petco Park on April 1st. As we wait to learn more about that, a judge has denied an attempt by some local businesses to bypass the state tier system and open up indoors. A judge denied a request for an injunction that would have done that. The group making that request includes some local restaurants and gyms, which said their businesses were not contributing to COVID spread. But the judge disagreed, saying they were gathering spots for people from different households where, in the case of restaurants, people remove masks to eat. Local restaurants will be allowed to open at limited capacity for indoor dining once case rates improve and San Diego moves into the state's red tier.
Let's shake up to the schedule on Capitol Hill today after intelligence outlined threatening plots being planned by militia groups. ABC's Mary Alice Parks in Washington with more.
Nearly 2 months after supporters of former President Trump's violently stormed the U.S. Capitol, law enforcement officials are worried some of the same militia members and conspiracy theorists who took part in the January 6th attack could try to breach the halls of Congress again. The top Republican on the House Foreign Affairs Committee with this plea on CNN, urging Trump this week to call off his supporters.
I think President Trump has a responsibility to tell them to stand down. This threat is credible and it's real.
An FBI intelligence report saying the so-called 3%ers, a known militia group, could allegedly try to get thousands to Washington this week, possibly also plotting diversionary tactics such as detonating a bomb. Followers of QAnon, a far-right conspiracy theory, believe the lie that the 2020 election was somehow stolen. They first thought the government would be overthrown on January 6th, and now believe Trump could return to power on March 4th, the date of the original presidential inauguration before it was moved up to January 20th in 1933. Capitol Hill already a fortress, completely locked down since the attempted insurrection on January 6th. The expanded perimeter still surrounded with fencing, razor wire, and the National Guard.
We have enhanced our security posture. We've taken immediate steps to let the National Guard as well as our workforce know what to expect.
Overnight, some security officials now saying they do not expect thousands to travel to Washington, but they are still mindful and on high alert. The House of Representatives is closed down today, but the Senate is still conducting business. Mary Alice Parks, ABC News, Washington.
Well, as the nationwide vaccine rollout continues, a new debate sparked by the timing of several states' decisions to relax public health restrictions. ABC's Rena Roy explains.
Today, outrage from the front lines as states like Mississippi and Texas drop mask mandates and lift most restrictions.
Why? Why do we have to do this right now? Why can't we just wait just a tad bit longer? So I think my initial reaction was shock. Like, people are dying every day. It's frustrating.
President Biden also blasting those state officials.
I think it's a big mistake. The last thing we need is the Neanderthal thinking that in the meantime everything's fine, take off your mask, forget it.
The CDC says the next few months are critical, with fears of another wave driven by new variants. Since the peak in early January, hospitalizations have plunged by 65%, but COVID cases have increased 3.5% within the last week, and deaths are up more than 2%. The governor of Mississippi defending his decision.
We are just simply doing the things to give our people the power back to do what they think is best for themselves and their family.
In Texas, daily cases have risen 75% over the last 10 days, the state ranking 48th in administering vaccines per capita. But some are applauding the governor's move.
I'm about done with masks.
At least 11 states recently moving to relax restrictions as the effort to vaccinate continues. 9 FEMA vaccination sites opening around the country Wednesday, from Pennsylvania to Florida. In New York, long lines at this site before doors even opened.
The first day they said you could apply, I did, and I got right on.
Now, despite the change in those state mask policies, some cities and large retailers, including Starbucks, Target, and Kroger, are keeping their mask requirements in place. Rena Roy, ABC News, New York.